me kick inside. Oh, fire! Oh, fire! Oh, fire! Oh, fire, fire, fire! Hey! Hi, welcome to ReneMarie Stroke of Luck on Madhouse TV. We're really honored and blessed to have this platform to bring some stroke awareness and aphasia awareness to you. And today's show is really, really touching and really emotional for me and very interesting, I believe. We talk about the brain and how the emotions of the brain and how aphasia and a stroke could really affect your emotions, and how most people don't really take the time to, I never took the time myself, to think about what the brain does for us and how a stroke and aphasia could affect that. So it's very interesting. We're gonna talk about actually Joe, our special correspondent, isn't able to come today and join us. He is not feeling well. He had suffered a severe brain trauma from, not only did he have 9 strokes, but he suffered a brain trauma on a fall he had, and it really, really, really set him back. And his doctors are actually saying that he's more affected now than he was when he had a stroke. And, you know, it's very sad. So, Joe, if you can, he may call in later on too, because he really wants to say his part in from the inside out. That's a theme to our show. So to my right, we have my co-host Bobby Baby Walker. Woohoo!
Howdy, everybody.
Yay! And to my far right, we have Cathy, Bobby's wife. Yay!
Joe, we love you and get well soon.
Yes,
Absolutely,
yes.
absolutely.
And I don't know, did we mention your position that you took for the language of love?
I don't think so.
I don't think so. I think I have a photo of Cathy that we're using for the. Do you have a photo of Cathy in there, Janine? I believe you do. No, I didn't give you one. I may have not given it to you. Sorry. We're going to use a photo for Cathy has taken on. We're gifted to have Cathy work with us on the Language of Love telethon as our telethon secretary. And it really is a big privilege and honor to have her. And we're blessed for her to be part of this team. And our team is getting bigger.
Privilege and honor.
Yay! I'm so happy. I'm so happy. So how's it going, both of you?
Good,
Yeah?
good,
Can't
good.
complain.
Good.
Besides the crappy weather.
It's raining. Well, rain is good for
It's all
us
right.
once in a while, you know. So, you know, I really want to let's talk about the telethon a little bit. Okay, we met 2 weeks ago, and we've all been doing our work. But we met 2 weeks ago, and of course, Cathy took the position as being the secretary of the telethon, which is awesome. And we also have Steve. Do we have a photo of Steve in there, Janine? Steve there he is on the left. And Joe, I know you're going to get mad at me, but I put a photo of me and Steve up. And we did take that as a selfie. Me and Steve are famous for us. Oh, there's Joe. There's Joe. There's Joe. We're going to show that photo later while he's talking. Hopefully he's going to call us in. But Steve took on a very interesting position, right? He has taken on being the volunteer coordinator, executive director of volunteers.
Big job.
It is a big job. It is a big job.
Absolutely.
And our thought behind that and our project plan is to get one person out of every state in the United States to support our telethon.
How awesome would that be?
That's awesome.
Right.
That's awesome. So if anyone knows anyone in every state, if one person could let us know, one person in every state, it really will trickle and really will start the filters going out towards everyone.
Absolutely.
Right. So I really want to take this opportunity to thank Valley Hospital. Valley Hospital in Ridgewood is where I had my stroke, experienced. I didn't experience it at Valley. I was taken to Valley after my stroke in 1989, and I'm really finding out from the inside out what wonderful people and devoted and dedicated people are involved in hospitals. Right, Kathy? I mean,
Absolutely. They put it all out there.
yeah.
They do.
Yeah, I was taught, I am a part of the acute stroke team at Valley Hospital as a volunteer representative who had a stroke. And they let me sit in on and put my input into stroke meetings. And it really is very, very empowering and emotional for me to sit there when they're all talking about, they're diagnosing each stroke that comes in to make it better for the next one. I mean, it amazes me. Every week they do that, right? I mean, that floors me. So I just really want to thank the Valley Hospital, and I want to thank all the hospitals and all the nurses and all the doctors and all the EMS and all the the pharmacists,
social workers, therapists.
Yeah, whoever is a part of that world, we want to give you a heartfelt thank you. You know, even the pastors and the priests and the rabbis and whoever is a part of, you know, giving support.
The process, right.
Giving
Families.
support. Families. Yeah. So let me see. So do you guys know who's going to be on our next show? My next show.
Karen Noe.
Karen Noe.
Yay.
Yay.
Karen Noe.
Actually, you say it's spelled like Noe, but it's Noe.
Noe?
Noe. Karen Noe. That's her.
Oh.
That's how you say her name.
Hi, Karen.
Hi, Karen. Well, we can't wait to spend time with you, Karen, so you can give us some inspiration. Let's go right into the discussion of emotions and strokes and the brain, right? If I was to ask both of you, what would you think? And isn't it funny? I said it in my PR for this. Isn't it funny we have to use our brain to talk about the brain?
Mm-hmm.
Right? That's ironic.
Right, yeah.
Right? And how would you feel if something happened and you couldn't process, couldn't think?
Be very frustrated.
Yeah. It's a frustrating feeling when you can't process the information.
Yeah. And you know, it's interesting. You know, the brain. You know what, Janine? Could you? I have a photo. I mean, I'm just putting this up because to show you what we're talking about. Can you put the photo of the brain up? I think I have a photo of a brain.
There it is.
Yeah, there it is. Just leave it up for just a few until I tell you to take it down. But it's really intricate, right?
Mm-hmm.
I mean, just the intricacy of a brain, and each lobe or cerebral.
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 With R?
Mm-hmm.
Right. So
Cerebral.
each cerebral and each cortex, that's also in there, cortex, that really is very interesting, and each play a different part to our emotions and able to function, right?
Yeah, absolutely.
It's pretty awesome.
Absolutely.
So,
It says that
I
left-handed
think-
people are the only ones in their right mind.
what's that?
Left-handed people use the right side of their brain, so they're the only ones in their right mind.
Yes. So, you could take it. Isn't it interesting, Tommy?
Checking it out.
Yeah, it's interesting. And you know, I mean, that was why we named this show From the Inside Out, because I really wanted to share my emotions on what it feels like to have a stroke, and I wanted Joe to share it as well. But I would like to ask you both, like, if you saw me, you would never know that I had a stroke,
Right.
right? And you were saying something.
When I first met you, I couldn't tell.
Right. Right. And when you said something to me back when we were, oh, that's what you were saying, that you never know that I had a stroke by all the
Right, by the way you function.
by the way I function.
Yeah.
But I was saying, what was I saying
You said
before, Kathy?
you
It
said
took a long road to get where you are, and you
Right.
can get overloaded, and
Yeah, and
yeah.
I just want to say that I know that it must have taken, a lot of work to get to where you are now, because when you have a stroke and you have aphasia, you can't. It's like being in prison, you know.
it is. It
A-
is.
And at least that's what I'm told it is. I've never experienced a stroke,
But
but
even go ahead.
but the way you carry yourself, the way you speak, and the way you keep speaking.
We were just on a show before this,
Yeah,
and
she-
they left
she-
the show and they said, "You forgot about me."
Yeah, she can talk, so I'm sure that she's over it now. I mean, it's still a work in progress, but
Yeah, yeah.
for the
Yeah.
most part, it looks like it's back to normal.
Well, I think, I mean, it's so. I really thought about how to express to somebody how it feels to be caught up in a mind, because our minds are everything, right? I mean, of course, I believe that our souls play a huge part in us, but our souls are not. Our souls aren't an organ, right? Our souls are just something spiritual that's within us
Spirit.
that gives our, shines light.
Right.
Our brains are this organ that really can be changed and altered by our patterns that we can teach it, right? But we have to be aware of teaching it. And I think that's the biggest thing that I wanted to share with people is that when I had my stroke, now looking back on it, I wasn't aware of where I was and what happened to me. And it's almost like, I put it like, I hate to say this, but a woman who was abused, right? And her husband or whoever isn't going to hit her, but she just kind of flinches anyway. So it's almost the same type of mindset because it's just a reaction. And it's a reaction that we need to know how to change back. Oh, that means the show is on. It's almost a reaction like we have to. So you both could share with me what I have to do, but if I can't process it and put it in my brain, how do I do it? How do I do it?
Right.
Right? I mean, does that make sense?
It does.
It does to me. In my field, which is music, I teach people, and sometimes you can tell a person exactly what you want. You know what you want, but sometimes they don't understand. They can't process it same way
Right.
that you can.
Right. Right.
And it
right.
takes several attempts to explain until the person finally comes to some kind of conclusion. Okay, I'm going to do this.
Right,
you know?
right. And I know that it's repetitious, but, and this is one of the reasons that I was chosen for the position I have at Valley, because I really have a deep passion to express how it is to have a stroke, and what it feels like. And I'm talking from the inside out, and I really admire all the hospitals that take in volunteers, and all the hospitals are doing this, because Joe is on a team in his hospital, and I'm on a team in my hospital, and I really appreciate and love the way that hospitals are changing their concept of patients and of family members, because it used to be like, we're the doctors, we'll do it, don't put your input in. That used to be the way it used to be, right, Kathy?
Right.
We're
And-
the ones that know.
Right,
So,
right. But now what they're doing is they're changing their philosophy and really taking those, embracing the family and the members to
Right.
really,
Right.
to share with them how they're feeling.
Yeah, especially those that have a positive effect on the patient.
Right.
Well, because
right.
nobody knows you better than your family or the
family,
people who
right.
love you. You know, the doctor can say, oh, this is shown to work, but it may be something that you don't normally process.
Right.
You know, and your family can say, no, she really does better,
Right.
with this approach
Right.
or that
Right,
approach.
right.
And it's
And
very,
they
very
share
important.
with the family members, and the family members carry it on
Right.
as the doctors go on and treat other people.
Yeah.
You know?
And that really, really, really is so empowering and and it's proven, by psychologists and by history that people that have family there recover much better and faster. Janine, do we have to take a break? No, what's that? Yeah, because it's 5 up. We're going to take a quick break, and when we come back, we're going to continue this conversation from the inside out, and I want to really thank Cathy and Bobby for talking to me about it, because it really is very emotional for me and really very important and very one of my passions to make people aware. And when we come back, I'll give you my personal philosophy. Pretty big word, right? My personal, and we touched on it a little bit, but you'll probably know what it is. My personal philosophy on the important piece to healing process. We'll be right back.
Hi, my name is Dr. Tom Dow. We have a multidisciplinary practice in Melville and Ronkonkoma, New York, and we treat patients with many, many different conditions, from newborns through geriatric patients with numerous different techniques. There's a technique and a type of treatment for every class of patient. We have them all here. Here's my son Thomas, also a doctor of chiropractic, working on one of our patients' cervical spine. This patient has had chronic neck pain for many, many, many years, has been to a multitude of different practitioners with little or no response. And with our specialized techniques, she has improved tremendously and continues to improve on a daily basis. We have two practices, one in Melville and one in Ronkonkoma, New York. We are a multidiscipline chiropractic office. What that means is we have chiropractors, massage therapists, acupuncturists, psychologists, all working as a team and a network of outside professionals such as orthopedists and neurologists that we work hand in hand with to help determine what your injuries are and the best way to treat your injuries. I have the great pleasure of having my son in practice with me. We work hand in hand, father and son, to give our patients the best care possible, and a staff which is loving, caring, and you'll never have to wait at all in our office for service. Many times patients come into our office and they have what's called a soft tissue injury. Soft tissue injuries are like scars inside your body. If you've ever been cut on the outside of your body, you get a scar. The same thing happens inside of your body to your muscles and ligaments. So our job is to determine where those are, stretch the muscles, adjust the vertebra back into their correct position, and then refortify the normal structure with exercise. That's what we do best, and I hope someday you'll come see us at one of our two offices. Thank you.
I am Tom Mealy for the Harrison Law Group, and I have been telling you for years that getting involved in an automobile accident is no joke. This is what we do. We're not new at this game. If you've been involved in an accident of any kind, and you go to a law firm that says you have no case, it's simple. It's because they can't do it and they don't get it. You need to call us directly at 1-800-INJURY-LAW.
YesWeCare.net is a 501c3 charity that provides help to veterans and their families. Please visit YesWeCare.net and donate in any way you can by purchasing our beautiful frame prints or relaxation CDs and DVDs, even smooth jazz CDs. YesWeCare.net. Remember, our troops are on their way home. They need all the support they can get. YesWeCare.net.
This is Beth.
Hi.
Oh, congratulations. When are you due?
I'm not pregnant.
Oh, look at that. Excuse me.
You're totally thin.
You look very sexy.
For life's bleachable moments, all it takes is 3/4 of a cup.
For professional motorcycle transport and towing, think Kickstart Fabrications Motorcycle Towing. Proudly serving all of Long Island, we feature expert handling and 24/7 service. So send a limo for your toy with Kickstart Fabrications Motorcycle Towing.
Hi, welcome back to ReneMarie Stroke of Luck. We're really having a very in-depth discussion and just really trying to find out if everyone in the world would know what it feels like to be from the inside out on a stroke patient. So, Bobby, why don't you read? I actually found something on the internet, was very interesting, that talks about the emotions and how. Do you want me to read it, Bob?
No, I can.
Okay. How it feels like, and I really thought it was important to get some information off the internet, because sometimes when one person keeps talking, it's kind of like, when I'm telling my story, there's no backing to what I'm saying, and this is, I did my research, as everybody could see. I have a bunch of papers in front of me, all detailing what it is. So read that. This is a couple bullet points about people who have had aphasia and had a stroke. And this is like asking people just things to know about it.
Okay, this is about the memory. It says, please have patience with my memory. Know that not knowing...
Sorry about that, it just scrolled off. Technical difficulties.
Not remembering does not mean that I don't care. Please don't be condescending or talk to me like I'm a child. I'm not stupid. My brain is injured and it doesn't work as well as it used to. You hear that? Try to think of me as if my brain were in a cast.
That's true. That's true. And that's. I mean, usually I'll bring light to it. If I can't remember, like I say, I can't always remember the specific name of the stroke committee that I'm on in Valley Hospital. Well, that's a stroke thing. That is a stroke thing, or people's names. I mean, I could know somebody for years, and just once in a while, I can't remember their name. Like it just drew a complete blank, and You don't
have to have a stroke to have
that
happen.
Yeah, I know. But I know, I'm aware of that. But it just, I think that everybody should have compassion for everybody.
Absolutely.
Nobody should judge anybody. Nobody should judge anybody, I think, because you never know the footsteps they had to walk.
Not all
Right.
illness has physical attributes to it.
As they say, walk
You
in
know,
my
a lot of
shoes,
it's
right?
inside.
Yes, that's very, 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 very true. I actually have a video of a gentleman that spoke, and I forgot his name. Duh. What's the gentleman's name? Oh. Yes, Bill. Bill. He spoke. He was a gift. I met him at Adler's Aphasia Center, and Adler's Aphasia Center is really where my brain clicked into me bringing awareness to aphasia. At my regular job in Wanacue, one of my careers, where I said before I work, there was a woman there. Her name was Roberta, and she was talking to me about my stroke and asking me how I was doing and all that kind of stuff. And she said, you know, I volunteer at a location in Maywood. And I said, oh, that's awesome. She said it was an aphasia center. She was telling me. I'm like, oh my God, that's awesome. She goes, I wanna bring you down and give a testimonial for that people can recover. You can recover, you know. And so I met this.
And that's very important to know.
It's hope. Hope
Absolutely.
is
Very
hope
important to
is
know.
around the universe. It's such a gift. It's such a gift. You know, if somebody's having a bad day and that person just comes to you, and they bring you hope. I mean, what bigger gift than that? You know. And I met this gentleman, Bill, and we were doing a fundraiser, and he actually said he'd come and speak. So run the clip, and he is a comedian. And I'll tell you when you could sign off of it, Janine, okay? But it's a great clip, and he is a great guy. This is Bill.
Good evening. When Renee told me to have a speech prepared, I said, "Oh, okay." I looked at the 7:30 to 8:15, and the ones. The word, the first name was Renee, and the third name was me. But in the second name was speaker and singer. I prepared for that. I want to.
That was Bill, and Bill speaks with aphasia. But it's so incredible to me that what it said before is there's nothing wrong with us. We just have a little malfunction. You know, we all break something. We break a leg. We break an arm. Mm-hmm. We have something go wrong. But he is such a gift to everybody, and such a prime example of he's got humor. You know, right. And you know, the way that I use my music as my crutch, you know, my way to get through and my determination. He uses humor and to really start the speaking engagement like that, you know. And he's funny. He was really good. Do you remember him, Bobby?
Yes, I do remember him.
He was really a great guy.
Yeah.
So you know, it's. I just got this in the. Why don't you read this, Cathy? I just got this from a friend of mine. And speaking of humor, I just received this in the mail today. It's an email, yeah, and it speaks of laughter. And you know, sometimes I love the book. What's the name of the book? Oh my gosh, it's by Lynn Grabhorn. And Excuse Me, Your Life is Waiting. Excuse Me, Your Life is Waiting. And that was really what got me on the reading and saying, "Oh my God, I'm not crazy. It's not me," you know. And but humor is really a key to recovery, and in Lynn Grabhorn's book, she speaks about if you can't get into it, fake it. Fake it.
Fake it till you
Fake
make
it till you make it. So read the laughter.
It says laugh. For today's mission, I want you to laugh. Yes, that's right. Laugh as much as you can today. Why, you say? Well, because laughter is truly the best medicine. We are all overwhelmed and overstressed, causing detriment to our own health. Stress is linked to almost 95% of disease and illnesses, so I'm a huge advocate of reducing the stress in our lives. So today, I want you to laugh, because laughter has many amazing benefits. And then it says stress relief from laughter. A good sense of humor can't cure all ailments, but data are mounting about the positive things laughter can do. Short-term benefits. A good laugh has great short-term effects. When you start to laugh, it doesn't just lighten your load mentally. It actually induces physical changes in your body. Laughter can stimulate many organs. Laughter enhances your intake of oxygen-rich air, stimulates your heart, lungs, and muscles, and increases the endorphins that are released by your brain. Activate and relieve your stress response. A rollicking laugh fires up and then cools down your stress response and increases your heart rate and blood pressure. The result, a good relaxed feeling. And then soothes tension. Laughter can also stimulate circulation and aid muscle relaxation, both of which help reduce some of the physical symptoms of stress. You want me to read the long-term effects?
No, that's good. That's good. But it is true, right?
It
When
definitely is true.
right? When you go out.
When I'm feeling depressed and somebody comes along and gets me to laugh, you know, it's like takes me out of myself.
Yes.
And I'm like, okay,
Yeah.
I'm back.
Yeah.
You know?
Well, you know, you hear people say, I have to laugh to keep from crying.
Yes.
And
Right,
it's
yeah.
so
Yes.
true
Yeah.
that, you know, laughter is good medicine.
Yeah.
Because
Absolutely.
I really admire the executives and just the everyday people that you wonder why they're laughing, but they're laughing just to keep going, just to have that positive energy.
And I want to point out that some people, I'm taking myself as an example. I used to get serious and want to stay serious, you know.
Not anymore.
And it was like a punishment to me, you know what I mean? And then I started coming to terms with laughter and how it made me feel, and I said, I'm going to go with this.
Yeah.
And
Yeah.
it made my life
Yeah.
100% better.
And those are the principles that we shift our brains to do. And we have to stay aware of those principles.
Right.
Like, that's why Dom Cortellessa defragmented my brain. He did. I speak about him and I hold him dear in my heart because here was a gentleman that was, it must be Joe. It must be Joe. Yes.
Yeah, it's Joe. How are you?
Hi, Joe.
Hello. How you doing?
Good. What are you guys doing?
We miss you. We spoke of your illness due to your fall.
Oh, I just got up and I ran over to the computer. Oh, now, okay. I got to lower this so I don't...
Were you able to get some rest?
Yeah, I did. I got a couple of hours, so thank God.
Good, very good.
You know, I feel better, but, you know, it was a rough week, a lot of complications due to the fall, and, you know, I'll be back to, you know, pretty much, you know, where I was. Not where I was before the fall, but at least better than what I've been the last couple of weeks. So
we're all glad that you're feeling better.
Thank you
and you're
guys.
feeling
Appreciate
well
all
enough
the
to call
calls
in
and
because I
concern
know you.
and prayers and everything, and you guys are a second family to me, and you know you mean everything to me. And I just wanted to call in and, just say hello to everybody and, just tell you keep going, continue with another great show. And, but I'll say one thing and I'll let you go. Renee, I just felt like something was missing today.
Aww.
I miss our little mornings and our coffee and our laughing and, doing what we do. But, we'll definitely make up for it next week. So,
yes, but
I'm not worried.
We were just talking about, Joe, how laughter and rest, I mean, I didn't mention rest, and that's one of the things that was written down is we need extra rest.
There's no question about that.
Yes.
And that's even my concussion specialist, who's a board-certified neurologist, and my neurologist, Dr. Leskiv. It's very, very important that when you suffer a brain injury, a stroke, anything that really happens to the brain, whether you trip, a stroke, or anything, it's all considered an accident to the brain, an injury to the brain. Yeah. And the only way that you could really get any type of healing process going on is by not stressing your brain out. Right. And, unfortunately, that's, believe me, and we all know, a lot easier said than done, because you still have to live, you still have to go on, but,
but
you have to do the best you can, and that's why a lot of times it takes a little bit longer, at least for me, than I probably would like it to. But, look, it's all part of it. I always say to myself, thank God I'm here, it's another day, and I just keep going and looking forward. And look, I have to come back with you guys to the show. I mean, I have
Absolutely. We got to get you back.
Joe, I really want you and then I'll let you go.
Go ahead.
I really want you to share with our audience, like I was sharing, really what it feels like from the inside out to be a stroke for your mind. Like how does your mind affect it?
Okay. First of all, and this isn't just a figure of speech, there is no way that anybody could possibly know what me, you, or any stroke survivor or traumatic brain injury survivor experience. It's like seeing a volcano erupting, and I can only try to make you understand, but it's hard. When you go through something like we went through, I call it, I was zoned out. I had no emotions. People had passed in the family. I couldn't cry. I wasn't sad. I wasn't happy. I had no emotions because that part of my brain was affected.
And
I
Joe,
was basically like in a vegetative state, even though I was awake.
And Joe, you even said to me, like at one point, you were just swearing up a storm, and that wasn't you. Like you were out of control.
No. That's another thing we'll talk about in detail. I have information on that.
Okay, we'll save it for another show.
Bulbar effect. That's where, to make it short and not get into it right now, it's where the filter system,
right,
your brain, is no longer there. So if I would say to you, good morning, Renee, all of a sudden I would be like a truck driver swearing up a storm. I mean, to my mother, I never spoke like that. But I thought I was losing my mind. But in 2007, when I had all mine, they said, okay, it's a normal process your brain goes through, but they didn't have medication. Now they do have a medication for it.
Yes.
So it's a very real thing that happens.
Yeah.
We think we're going crazy.
Yeah, I know. Well,
understand it.
That's why I was saying, like, there's been a lot of pinpoint moments in my life where, the book, Excuse Me, Your Life is Waiting, I was like, wow, like, I'm not crazy. And the other day I had an aha moment with you, which really brought me to the show. This show is in thanks to you. And you said to me that if you could help one person what you've gone through, you're happy to go through it. And Joe, you're helping the world. You're helping the universe. So your one wish has been multiplied by millions.
Thanks, Renee. That means a lot to me.
Yes.
Because sometimes I wonder if I am. I'm told I am, but I don't see it. But I'm not looking for somebody to come up and pat me on the back. But if I can reach one person and help them go through it and make it a little easier for them, I don't regret what I've gone through.
Right.
And I'll be very honest with you. If it wasn't for the fact of the strokes, the that, we never would have met.
That's right.
I mean, there's a reason for everything.
That's right.
So
We said that
right
before.
now, at my age of 39, I'm in the best place that I could possibly be in. And I mean that sincerely. Even with all the ups and downs. That goes with life. There's no straight and narrow path. There's ups and downs, and we have to take them as they come.
Yes. So we're gonna cut off, Joe, because
okay, and I'm gonna go too. So
because
you have a great show.
Thank you. We miss you. Yes.
I miss you guys too, and I'll talk to you during the week.
I'll talk to you later when I'm on my way
Kathy,
home.
Bobby, take care, guys.
Love you.
Bye, Renee.
Thank you, Joe. Bye. I'll see you later. We're gonna take a quick break, and then I'll finish my Dom Cortellessa story because I really want to share it with you. And I'm going to share my philosophy, which I never got to, but normally I kind of forget and just go off. But those are two things I'm going to share with you from the performing stage, and then I'll go into singing a song, Both Sides Now. That's a song I'm going to be singing. But I want to thank Cathy and Bobby. I know they have to run because they're going to some music gig somewhere.
Yeah, we're treating our very good friend John Mignon for his birthday. Happy birthday, John.
Happy birthday,
We're going
Jay.
to see the New York Rat Pack.
Okay.
Yes.
Well, thank you for, because I know you kind of
pleasure.
stuck it in.
My pleasure.
Especially you, Cathy. Bobby, I know, was going to be here, but thank you for coming by.
Thank you.
And we'll be right back.
My name is Dr. Robert Brevard. I'm here for Multi-Medicine in Westbury, New York. We're located at 1065 Old Country Road, Suite 214. Been here for about 15 years. The practice has medical doctors, physical therapists, chiropractors, acupuncturists. We also do pain management, and we have orthopedists on staff. Here at Advanced Multi-Medicine Rehabilitation, we've got physical therapists on staff who treat an array of conditions, from neck pain to back pain, shoulder pain. We treat carpal tunnel. We treat a lot of car accident patients, slip and falls. We treat patients with knee injuries, with ankle injuries. We have state-of-the-art equipment. We've been here for over 15 years. Vast array of diagnostic testing, from x-rays to EMGs. What is an EMG? It's a diagnostic test that allows a doctor to determine where the pinched nerve is. Cora is a physical therapist at Advanced Multi-Medicine and Rehabilitation. She's working on Stephanie, who was involved recently in an automobile accident. Stephanie has tight thoracic and cervical musculature, and Cora is doing some myofascial release work and some therapeutic stretching, doing it to help her with her pain. Vicky is also a patient here at Advanced Multi-Medicine and Rehabilitation. Vicky is now working her leg muscles, specifically her quadricep muscles, trying to strengthen them after an injury she sustained. If you find yourself in need of any type of physical therapy, please don't hesitate to call Advanced Multi-Medicine and Rehabilitation, located in Westbury, New York, in Suite 214. Phone number is 516-334-7000, or find us on our website at advancedmultimedicine.com.
Being a fireman is more than just putting out blazes and giving kittens CPR. Sometimes my duty demands I fan the flames, like when a call comes in from a lady who needs immediate assistance. Maybe she needs help with a computer thing. Maybe she wants to go antique. Could be as simple as understanding that walking in heels it's hard. Aussi simple que l'été dernier à Paris. C'est sympa. Maybe it's ladies' night in, and she wants a simple, delicious recipe for margaritas with a twist. First, a can of limeade. Now hold on to this. You'll be using it. Side note, kittens make everything better. Next, add water. Now, a bottle of light beer. No, shh. Trust me, I'm a professional. And last, and most important, Sauza Blue tequila. Now, mix it up. Ole. Yes, that's what I'm trained for. Whether it's to help her choose leggings or pants, telling her leggings are pants, or discussing leggings and jeggings versus pant pegging at her next ladies' night in, I'll come to the rescue. Don't call me a hero. Just call me. Let me know what time.
Dad, where do babies come from?
Well, there's that big, shiny rocket ship. That's right, it's filled with babies of all kinds. And when the shiny rocket ship penetrates, Mommy and Dad goes, and when the time is just right, there's a space launch.
All systems go.
Babies of all kinds, released all over the place. Yeah, Africa. Mommy's Babylandia. That's right, it's filled with babies. After an amazing 9 months, babies. And that, son, is where babies come from.
But Jake said babies come from
Planet Babylandia.
You know, play with us on the bus.
the wheels on the bus
Go round and round, round and round, round and round. Wheels on the bus go round and round, all through the town.
For professional motorcycle transport and towing, think Kickstart Fabrications Motorcycle Towing. Proudly serving all of Long Island, we feature expert handling and 24/7 service. So send a limo for your toy with Kickstart Fabrications Motorcycle Towing.
Hello, welcome to ReneMarie Stroke of Luck. I'm really happy to have this platform to share a little hope for everybody. I think that's what we get out of this show. We bring a little hope to patients who have had strokes, and I really hope to bring awareness to family members and to people who have had no stroke symptoms in your entire life. Because if you're aware of strokes and you're aware of the face of, the face that tells you whether you're having a stroke, which you can find online at all the stroke facilities, just Google face strokes. It'll tell you the symptoms to look for when when you're having a stroke. And it really is important to know that, because we could save your life. You could save your own life. You need to save your own life. We need to be responsible ourselves and everyone around us to know if someone else is having a stroke. It's so important. It's so important. Before I sing Both Sides Now, which is a great song, which I'm probably going to have to play with this thing next to me, the computer, to turn it on when it comes. But I want to finish my story about Dom Cortellessa. Dom Cortellessa is an individual who is a godsend to me, who helped me to defragment my brain and to really understand and put the pieces back in place. And that's literally what he did. And he did it through my philosophy place. My philosophy on the for recovery for any sickness or any illness or any recovery is, and Tommy would like this, it is love. Love is the number one important thing that we need to give to each other to recover. Because if you don't love someone, if you don't show them love, then they're not going to have that trust. And that trust that comes from love is so important to trust, because then you open your heart and you open your mind and you open your body for recovery, because we have to let recovery in. So it really, 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 really is important to be loved and to be compassionate for people and to show them love. So that is my philosophy on life. Do I need to go into the song? Is that what you're saying? Okay, no problem. So even if we have to flow out of it with this song, okay. So we're going to go right into Both Sides now, which is a song I haven't, this is actually the first song I ever performed in my entire life. I performed it at Mary Help Christians camp when I was there, and I love this song. So let's rock and roll with it. Great words. Listen to the words. Bows and flows of angel hair and ice cream castles in the air and feather canyons everywhere. I put the clouds that way, but now they only block the sun. They rain and snow on everyone. So many things I could have done, but clouds got in my way. I've looked at clouds from both sides now, from up and down, and still somehow it's clouds, illusions I recall. I really don't know clouds at all. The dizzy dancing way you feel as every fairy tale comes real. I looked at love that way, but now old friends are acting strange. They shake their heads, they say I've changed, but something's lost and something's gained in living every day. I've looked at love from both sides now, from up and down, and still somehow it's life's illusions I recall. I really don't know life at all. Kicks and jeers at Ferris wheels, the dizzy dancing when you feel as every fairy tale comes real. I looked at life that way, but now there's just another show. They live on laughing when you go, and if you care, don't let them know. Don't give yourself away. I've looked at life from both sides now, from up and down, and still somehow it's life's illusions I recall. I really don't know life at all. That's the truth. We don't know about life. We don't even know what's going to happen in the next 5 minutes. We're going to flow right into, that was a great song. We're going to flow right into a song that really means something to us, and it's called That's What Friends Are For. And we are blessed to have all these friends. We're blessed for Bobby and Cathy and Joe and Tommy and Janine and everybody else in the world. And we really hope that you'll come and join us on this journey for the telethon. Here we go. And I
Never thought I'd feel this way. And as far as I'm concerned, I'm glad I got the chance to say that I do believe I love all of you. And if you should ever go away, well then close your eyes and try to feel the way you do today. And then if you can remember, here we go everyone, keep smiling, keep shining, knowing you can always count on me. For sure, that's what friends are for. For good times and bad times, I'll be on your side forevermore. That's what friends are for. God bless everyone. Let's go, Bob.
That's what friends are for.
Let's go. Blow our kisses. God bless. Have a stroke of luck.
God bless Renee.
Bye, Joe. Feel better. We love you. See you later.
Get on the Woodstock Brew. I haven't seen you yet. God bless you.
God bless.